Assalamu alaikum. The communication day, the scenario, Mr. Hani, 77 years old, was complaining of a severe stricture and difficult swallowing. He is losing weight and dehydrated because of his esophageal problem. The treating team, the consultant asked for esophageal dilatation for his best interest. Mr. Hani had esophageal tear during endoscopic dilatation procedure and he is now NPO and under observation, waiting for spontaneous tear healing. One of the nurses told Mr. Ahmed, his son, that his father got a hole in his food pipe. You are the medical senior house officer on duty, so sit with Mr. Ahmed and discuss the condition of Mr. Hani with him. Most welcome, Dr. Ahmed. Okay, Dr. Azhar, ready?
Yes.
Yeah. Okay, here you go.
No, hello.
Yes, hello.
I'm Dr. Azhar, one of the junior doctor in the gut ward. Are you Mr. Ahmed, son of Mr. Hani, 77 years old?
Yes, I am, doctor.
Okay. Today we are here to discuss the health issue regarding your father. Is that okay with you?
Sure, doctor. I am the one also want to talk to you.
Okay, very nice to hear from you. Okay, before we start, I just want to ask you, how much do you know about the condition of your father?
What I know, doctor, that my father was having a problem in his swallowing for a couple of weeks. And when he was seen by the gut doctor, he said to him that we need to do some surgery and procedure for him. After that, I don't know what happened. My father was admitted last week, and he didn't tell me about this admission. And when I know that he is in the hospital, I visited him, and I was shocked when I heard from the nurse that my father had a procedure and he had as well a hole in his food pipe because of maybe I don't know. Is it mistake, doctor? I want to know.
Uh, I I just appreciate your concern, how much you are worried about your father. Before I proceed, I just want to know what are your expectation from today consultation?
I guess, doctor, there is some mistakes by your team happened. I hope you can clarify the things for me.
Thanks for the appreciation. I just want to clear you that regarding the mistake, this is not a mistake. Actually, when your father came, he has some problem narrowing of his food pipe. You can say, I
Uh-huh.
just want to explain you, this is a food pipe. And your father, he was having narrowing of the food pipe in his the food pipe. So, and that's why he was having problem with the difficulty in swallowing. So our consultant decided that we will dilate this narrowing passage so that his problem of the swallowing will be removed. So, in his best interest, our team decided that we will do a procedure, and this procedure will be done by through a camera, and it is done by a very expert team who are doing many such procedures, and they are doing for many years. And during the procedure, this there is we came to know that there is some tear in the food pipe. Are you with me?
Yeah, doctor, I'm listening, doctor. So, doctor, you are defending your colleague, right?
No, no, no. I'm not defending my colleague because the every procedure has some. If every procedure has benefit, it also has some complications. And before this procedure, all the benefits and the complications were explained to your father, and he was agreed to go for this procedure. How does it sound to you?
Yeah, doctor. So you are assuming that my father know about these things, right?
Yes, yes, yes. We did not have informed your father, but it's your father, right? If he wants to know, we have to inform all these things that We did the procedure, and by unfortunately, there is a tear in his food pipe. So if he will ask, we will not hide anything from your father, because he has the right to know each and everything about his problem. And before we also explain him before the procedure everything about the benefits and complications of the procedure, and he was agree and he signed for the procedure. Is that okay with you?
Yeah, doctor. Okay, I understood now. So, doctor, what's your plan with my father now, doctor?
The plan is that now our team has decided that we will not give anything by mouth. We will give fluids, nutrition by IV channels, and we will see. And we are waiting for the spontaneous healing of this tear. Most of the time, these tears, these holes, they heal without any no problem or complications. So our consultant decided that we will not go any for any invasive procedure. We will wait and see, and we will not give anything by mouth. We will give all the food and nutrients through the blood channel. Is that okay with you?
Yeah, doctor, sure. As long as my father will be okay and safe, yeah, it's okay. But for how long, doctor? It will take till will be
I
resolved.
cannot give you, I cannot give you any specific time, but you see, we are here. Our whole team, they are monitoring him minute by minute, and our consultant, they are daily, they are monitoring him. And as when they will think that now the patient, your father is well, and the hole has been repaired, then we can inform you about your further condition. Is that okay?
Yeah, doctor, sure. Okay. What if I want to take him home, doctor? I am a nurse and I can take care of him.
I appreciate your concern, how much you are worried, are concerned about your father. Uh, may I know, why do you want to take your father to whom?
Because I want to take care of him. I want to take care of him by myself, doctor. I am a nurse.
I appreciate your concern. You see, anything can happen. If your father will be in hospital, if anything can happen. Likewise, if some his condition deteriorates or some fluid goes into the lung, we can give him the proper treatment at proper time. If he will be at home and he has any complication, then it will take some time to reach to the hospital, and it will not be in his best interest. So, in our opinion, it's better, unless our consultant will not decide, your father should remain in the hospital. Is that okay
Okay,
with you?
doctor. Yeah, doctor. Okay. What if I want to take him another hospital, doctor?
Okay, your concern is very well valid. You see, the protocol will remain the same. If you will transfer your father to other hospital, the protocol of treatment will be the same. It just only you will add suffering your father. So for this purpose, it's better he should remain here. And if your father wants to go, then we have to discuss with your father. If he wants to go, he has a right to go. But in our opinion, it's better if he will stay here, unless our consultant will not declare that he has no more complications and no more no problem. So it's better if he will stay here. Is that okay with you?
Yeah, doctor. Yes, it's okay. Okay, doctor. Thank you for your effort with my father, and I appreciate your care to my father. 2 minutes
Thank
left.
you very much. I just want to ask you some questions.
Yeah, doctor. Sure.
Uh, your father, what, now does he smoke?
Yeah, doctor. He was a smoker.
And how many cigarettes?
He's heavy smoker, doctor.
Okay, okay. Please, any amount of smoking is injurious. So it's better we will discuss with your father. He should stop the smoking, and if he will be agree, then we can help in this regard.
Okay.
Does he drink alcohol?
Yeah, doctor. He's drinking socially.
In the social limit, or
I guess in the social limit, doctor.
Okay. What is his job?
He's retired, doctor.
Retired. Do you need any help from our side?
No, doctor, just your care, and I appreciate your care to my father. I don't need anything else.
And now who is supporting your father at home?
Yeah, my mom taking care of him, doctor. Along with me, I am visiting him from time to time.
Do you need do your mother or you need any support from us?
I appreciate, doctor, you're asking, and I think if she need, I will contact you. Yes, of course. Thank you, doctor, for your offer.
Okay. Do you have any other concern?
I don't think so, doctor. Thank you so much.
Okay, I will give you some brief in leaflets and brochure where all the informations will be written, and you can read about this. And if you go to the home after recovery, if your father develops any complications, any problem, you can come anytime. You can contact us anytime. We are at your service. Is that okay with you?
Sure, doctor. Thank you for your kindness.
Okay. Welcome. Do you have any concern?
I have concern. I want to give you full mark. Really, mashallah, Dr. Azhar. You are perfect.
Thank
Mashallah,
you. Thank you.
mashallah. Every concern you address it perfect. No
Thank you. Thank you.
comment, no added point to be clarify. You clarify everything. You explain everything. Really, I
Thank
don't have comment. Mashallah, mashallah.
Thank you, thank you. It is all because of you. Because
No, 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 no.
you,
Your effort,
I
your mashallah, someone is doing effort to
The
study and
point on
you're
that we
careful.
didn't tell your father about the complication. It is in the
Yes.
scenario.
No, it's not in the scenario, but he covered it well. He assumed
But
that
I think we should inform, even if not asking. I think after the procedure, we should
he,
inform
yes,
about the result of
suppose,
the procedure.
yes, of course. Suppose,
Mhm.
suppose if I raise it, he will say it. But yeah, he added from himself. But it's okay. It's not harming because the patient will know sooner or later, or he maybe know and
No, we should inform him. He is competent. We should inform about the result and the complication is due to control to inform about the harm
he
happened.
he he
Mm.
must and he should assume that his father know. But Dr. Azhar explain it like his father still didn't know. But suppose his father know because this is the
Because he
procedure.
is aware and oriented.
Of
Yes,
course,
okay.
yes.
Uh-uh.
Now the son asked about the complication, but I wish Dr. Azhar if he didn't say we will tell your father because the father of course no. I'm asking
Yes,
about the
because you are
consent.
keeping him without food, so he should.
Yes,
I
of
think he
course
know.
we
Yeah,
we pretend that the father knows
but
because
other than
already
this, very well done. Yes, the scenario
yes
is
yes
perfect. Yeah,
yeah, I agree yes he did it well yes but yes the point of if your father know or not I wished not to say it Dr. Azhar but it
hmm,
will not harm the back okay but
okay.
let's say I'm asking about the consent itself did my father know about this is what my question was about did you tell my father about the complication and you said it already but the point of saying your father should know about the complication, who told you he doesn't know? So don't assume it, okay?
Okay.
The son only didn't know it because he just came and he found his father in this situation. But suppose any complication happen, any side effect, anything in the plan, of course the father will know about it. The one now wondering what happened is that the son. Why you didn't why this happened with him. He didn't say that his father doesn't know or no. So don't assume it, okay?
Okay. Okay. Okay.
But anyway,
Yani,
it will not harm. It will not harm.
I
Yes,
mean to say that now already we have explained each and everything complications to your
yes,
father.
yes, yes, yes.
It's better. It's better.
Yeah, because he signed the consent and he knows everything now. If you don't know, okay, we will tell you, and you have to ask about also next of kin, and we assume that your father get permission. You miss only this point in this introduction, Dr. Azhar. You have to assume
What?
that
Hmm?
you got a permission from the father to
Yes,
talk.
sir. Yes, sir. Yes, yes.
Yeah, because
I know.
the son now doesn't know anything, and he will ask about something related to the father, and the father is fully awake and has fully mental capacity to decide without his son interference, right? But if you
Yes.
want to say, I assume that I got consent from your father or I got permission from your father to talk about his condition, because now the son asking about his father, you have to assume it from the start, okay? This
Yes.
is only the point you miss, the next of kin and the permission from the son, from the father, okay? Apart from this, really, all concern, you answer it and you address it in a proper way.
Thank you. Thank you. Yani, I should say, are you next of kin? And we have
Yes,
got permission from your father
yes,
to
because
discuss
you
his
are now,
condition with
exactly, you are now saying and you are breaking the confidentiality. Maybe if you didn't say it, it might be like from the examiner. I mean, he will say he didn't confirm the confidentiality, and the son now came to you, and he didn't have, or you didn't have permission from the father to talk about his father condition, and it will be against the confidentiality. Better to
you.
assume it, okay?
Okay, okay, thank you.
Okay. Other than this, you well done, Dr. Azhar. Any comment from other, any question? Sorry. Okay, Dr. Aisha, you have other question or comment?
No, no. Thank you.
Okay, thank you. Let's, Dr. Azhar, if you have your comment, yeah, sorry, your scenario, please
Yes, I
post
have
it.
posted in the group. I have posted in the group.
Okay, good. Anyone has doubt about this scenario, please, he can ask. Because this scenario comes and goes. Okay. And Mr. Daniel, I will share it. Wait.
You can write any age, 55 years like this.
Okay. I will try just to copy it. Okay. Mr. Daniel was admitted to the hospital 5 days ago due to infective exacerbation of COPD. His condition improved after getting usual antibiotics, amoxicillin, and supportive care, oxygenation nebulization. A nasal swab has been taken. The result shows MRSA, methicillin-resistant Staphylococcus aureus. But he has no evidence of MRSA infection with the negative blood culture and sputum culture for MRSA. The patient has been isolated and all necessary precautions have been taken. The task is to talk to the wife, Mrs. Annette, and address her concern. Consent from the husband has been taken. Okay, you mean for the isolation, right?
Yes.
Okay, give me 2 minutes or 1 minute only to prepare. Nice drawing, but I didn't see narrowing in the esophagus you draw. Yeah, you tried to make narrow, but you didn't make the narrow.
Yes,
But I guess in the paper you will be more able to
inshallah.
make it, yeah, more clear. And always be simple, like what you did exactly, 2 lines and make narrowing at the middle or at some point. It's more than enough. Okay, Daniel, how old is he? No age, right?
55.
55. So okay. Okay, let's start the class.
Okay.
Okay. Hello, I am Dr.
Yes,
Mukhtar, the doctor in the ward today. You must be Mrs. Annette.
yes,
You are the wife of Mr. Daniel.
yes,
He is 55 years.
yes,
Uh, I guess you are the next of kin for him.
yes.
Yeah, we are here to discuss about his health condition after getting permission from him to talk about that. Is that okay
Okay.
for you?
Yes, yes, yes.
Yeah, please, before moving on, can you tell me what do you know about Mr. Daniel condition so far?
My husband, he is a known case of COPD. 2 days before, 5 days before, he was having increase in shortness of breath. Then he was brought in the hospital. He is there in the hospital for 2 3 days, and his condition is improving. But now I'm very much surprised. He is improving. Why he has been isolated and he has been kept in a separate room? I'm confused about what is happening with my husband. Please, can you explain me?
Yes, I appreciate sharing this with me, and I appreciate your worry about your husband, Mr. Daniel. Be sure that we are here to address all your concern, and please, if you have any doubt, you can stop me anytime and ask me. But before explaining to you, what's your expectation about ongoing now?
I just want to know what is going with my husband, why he has been isolated, although he is improving.
Yes, I appreciate your worry again, Mrs. Annette. Actually, what he had is an it's not infection clearly, but he has a positive swab results. If you let me allow, if you allow me, I will explain to you what is the result for.
Okay, yes, I want to know.
Yes. So for our patients, usually we are doing a swab, means we can take a snip or sample from the skin or from the nose to know if they have dangerous bugs in their body. Usually, our body can fight these bugs. However, if we have discovered these bugs in any patient and we are worried to spread this bug, I mean to be spread to other patients, we do what is called isolation. We follow this protocol and guidelines for every patient in the hospital in the best interest for the condition of the patient. Are you following me?
Yes, yes, I'm following you.
So what happened with Mr. Daniel? We did this swab and we found it. He has it in his results. And in our medicine, we call it MRSA. It's an abbreviation for a superbug called methicillin-resistant Staphylococcus aureus. However, in his condition, it's not spreading to his body inside. It's only from outside, uh, from the nose only. So we are taking care of this by putting the patient, I mean Mr. Daniel, in a side room. Still, you are following me?
Can you tell me why he was shifted into side room? Because he was improving.
Yes, I appreciate your worry, Mrs. Annette. It's not the matter of improving. Yes, he is improving, but still, this bug, we can find it in any part of the body. And once we find it, we have to put a patient in a side room in order not to be spread to others. And also, we can take care of him by putting him in a side room. Are you
Okay,
still
yes,
following me?
yeah, yes. So what you will do to spread this bug from the from his nose to the other parts of the body?
Yeah, so that's why we put him in a side room. What we will do now, we will put some wash in his nose, and also we will put some precautions in case of anyone going inside to touch him or to visit him. He should follow these precautions. And I hope all of you, as a family member, to follow these rules and protocol in order to prevent this bug to be spread to the family or to others outside the hospital. How that sound for you?
It's okay. So for how long you will keep my husband in the isolation, and what precautions you are you will give to my my husband?
Yes, I appreciate your concern. Actually, we are putting the patient or anyone has this result in the side room for few days until we can repeat it after this duration. And if it is negative, we can remove this precaution. And for the precaution, just before going inside, you can wash your hand. You can wear what's called yellow gown and some gloves on your hands. This is what's we called in the medicine contact isolation. Don't bother about the name, but this is the rule. And before going out from the room, you have to remove this gown from over your body and to remove the gloves step by step. After that, you can wash your hand and leave the room safely. How that sound
Okay,
for you?
it's okay. And then will he needs daily changing of his bed sheets and clothing?
Usually, Mrs. Annette, in our hospital and in our ward, we are changing the dressing and the bed sheet every day. We have routine time for bed making, and we always make cleaning and washing our patients to be sure that they are clean and they are fine for the next day. Usually, it's overnight.
Doctor, I have heard about this superbug. That with this bug, a patient can die. So my husband will die.
I appreciate your worry, Mrs. Annette. No, it's serious if it's found inside the blood or he has any signs of infection like high body temperature. However, we just found it in the nose, and for that, we are taking care of that by doing the washing of the nose. So,
Okay.
as long as it's not inside the body, it will not be that serious as we are worried about.
Can I take him home? Because you say it is not serious. So can I take him to the home?
Yes, I appreciate your worry. It's unserious for healthy person. However, if we have anyone with weak defense system, it will be more serious, like kids or if anyone at home with defense system being weak, it might harm them. So I need from you to leave Mr. Daniel for a couple of days until it will be cleared from his nose. After that, safely you can take him home. How that sound for you?
It's okay. Can I get from him?
I appreciate your worry. Yes, it's one of the possibility to have this if you didn't follow our precaution. That's why we need from you before going inside or leaving the room to follow our precautions.
Uh,
Okay?
one nurse told me that we are applying some bug killing cream to for how many days you will continue this cream in
Yes,
his nose.
yes, as we have been discussed earlier, it will be for few days, mainly for 1 week, or it might reach to 2 weeks. And after that, we can repeat the this swab to be sure that it's cleared already.
Okay, thank you, doctor.
Okay, can I ask you some questions?
Yes,
Anyone dependent on Mr. Daniel?
yes, I'm dependent on him.
Okay, does anyone else dependent on him apart from
No,
you? Do you need any
no,
help or
no,
okay, you have any other concern?
no.
I will give you some leaflet brochures about this bug and the precautions and our isolation rule and our contact number. If you have any inquiry, you can contact us. And please, if anytime you have or any one of your family feel unwell or high body temperature, seek medical advice or call your GP immediately. Is that okay?
Is that- Thank you very much. Thank you very much.
Okay.
Time over. Thank you very well done. Well done. Thank you. Time over.
Yeah, thank you, Dr. Azar, for the scenario. But yeah, tell me now.
No, no, mashallah, you did 100% well. Only just I want to add one thing. If
Yes.
they ask you for how many days you will use this
Yeah.
antibacterial cream, we are using 5 days, and after 5 days, we will wait 2 days for again we will repeat the test. If this test will be negative, then he safely go. If the test
Perfect.
is still positive, then again we repeat another course. But only I
Okay.
just want to add everything you address perfectly. Alhamdulillah, mashallah, mashallah,
So it's
perfect.
1 week, right? It's not 2 weeks.
5 days, 5 days written. 5 days.
Yeah, I said few days, but when you
Yes,
insist to
yes,
know about duration, I make it
yes, yes.
mistakenly. It's
Maybe,
okay.
maybe in the exam, maybe he can ask how many days. That's
Yeah,
why
sure.
I was
Yeah, yeah.
intentionally asking you.
I believe whenever you have mistake here, better than in the exam. So now
Yes, yes.
I remember it's 5 days, then repeat the test. After
And
that,
in 5 days,
we'll
we
decide.
will complete the treatment. And then
Yes,
after 2 days, we will wait. Then
yes.
yani on the
Repeat it
seventh
again.
day, we will repeat the test.
Okay, okay. Clear now.
Rest of
Thank,
thing, everything you did very well, mashallah. May Allah
thank
bless you
you.
for your exam,
Thank
inshallah.
you, Dr. Azar. Thank you so much. I appreciate. Thank
But
you.
there is question here.
Yes.
This patient not infected. So all the nurses, yes, will take the precautions that you said. But for the family and for the visitor, no any harm about for them. We fear only for isolation from this patient about the other patients that maybe have immunocompromised condition and have open wound surgeries. So we fear about infection, spread of MRSA. But this patient, he said that the sputum culture negative and he blood culture negative. So just he is carrier or
Yes, yes,
like
he is a carrier. He is a
yes.
carrier.
So we
He is a
isolate
carrier.
him for the purpose of not harm other patient, not for
Yes, yes,
um,
yes, yes. Yes,
dangerous
the
of
isolation
others,
was
يعني
just to
visitor
prevent.
with good immunity.
Yes, you are right. To spread the infection to others. The purpose of isolation was, it was the only purpose.
So the
You are right.
family will follow the precaution, Dr. Azhar, or no need? This
Yes,
is the
yes,
No,
yes.
question from
Yes,
Doctor.
no,
definitely,
no, no,
definitely they will follow. They will follow
no,
because
no. The contact, no, because I am working in these sets for very for a long time, but no any precaution for the family, just the nurses because the nurses will kill the other patient. Because it is
because
not harmful, it is normal commensal of our skin. You may have this in your
No,
skin and you don't know.
sorry, Dr. Aisha. If MSSA, if the methicillin sensitive, yes, it's not harmful and it's colonized over all skins. But once or since it is MRSA or methicillin
Because it's
resistance,
not
we should.
present in hospital only. But you will find uh,
But the
a
resistant,
nurse or
please.
anyone have this bacteria with no any harm. Don't
But
have any
the
problem.
resistant one should be taken as
But no
precaution.
treatment. If you carrier, no treatment. Yes, you will not
uh,
take any treatment.
Dr. Aisha,
Just
No, no,
it's
precaution.
a
no.
book. All these questions I took from a book, and it's written that you must isolate the patient
Because we
to
have
prevent the
one
spread.
scenario in Rider, we did it before here.
Mm-hmm.
If you remember, Dr. Bassam, about the patient that in a
Bit
care
source.
room,
Yeah.
yes,
Nursery.
and
Yes.
we discussed this, and the Rider write it clearly that he can have the open meeting and he can family can visit him, no problem. Just he will be isolated because harm of others, because there is
Mhm.
others have wounds and others immunocompromised. So if this MRSA get them, they get it from this patient or from this carrier, they will harm more, and it is difficult to treat by antibiotics. This is the point.
But colonization has treatment, as Dr. Azhar.
Yes, that like chlorohexidine wash and
Wash
like that.
and
Yes,
misperone, yes, for 5 days, and then wait 2 days and do the test.
yes,
And
like that.
Okay.
And we did
Okay. Look.
this. We isolate, and the nurses should wear and the doctors wear all the contact precaution, and as Dr. Bassam said. But for families, no, it is not like meningitis, not like TB, not like the contact infection.
Okay.
but I think when a person is isolated in one room, it's written on the room isolation, so anyone entering the room should wear
Yeah.
isolation.
This is what. Yeah. This is
This
what I
is what
believe also.
I don't. I didn't. Even the relative. Anyone enters the room, you should respect the isolation precaution.
Maybe the scenario, Dr. Aisha, we did before, it was about the nursing care, not hospital patient or not hospitalized patient. That's why he doesn't need isolation. You got it, Dr. Aisha. But I guess in all hospitalized patients should be isolated, even with the family during visiting time.
Yes. Because in the book it's
Okay, I
clearly
am
written.
really, I don't know about the UK, but this is what I said about here. So I don't know really. يعني.
Dr. Aisha,
No, no.
in the book, it was clearly written that all the contacts they will have a proper precautionary measures, and they will wear mask, gowns, and apron. Without this, they will not go to the patient unless his swab will not become negative.
Okay, we can ask also for another and fourth opinion. Anyone has background about this?
Yes, yes,
Please
yes, yes.
share it. Share it with us. Anyone with us here? It's
Assalamu
open
alaikum.
discussion. Alaikum salam. Yes, Dr. Ahmed.
Uh, I think for this one, first you should, you should not offer first to visit. If they said you can visit, you should tell them to say better to be away, okay? Because even if this colonization, but it could spread. Okay, if he ask about children, because you tell them children they have no immunity. Okay, if he insists to come, you tell them they should not take a long time, and he should take the precaution for the patient when they enter the room. Okay, and I think if the patient is, they said if the patient is the like home care or home care, okay, with other old people, we will not
Yeah,
isolate
the
him from
nursery
them.
care. Yeah, the nursery care. You
Yes,
mean?
in
Yes.
nursery care, he will not be isolated. But in the
Mm-hmm.
hospital, he should be
Yeah,
isolated.
yeah, yeah. Okay,
But
this
for
is
the
clear
family,
now.
they should take only like gloves and maybe gloves. I should not stay a long time with, because this is, I think, it will be policy. Like, should not
Yes,
have
yes. It's our
contact.
protocol.
Yes,
Yes, yes,
yes,
Likewise, we were having when we were having corona, there was a
yes.
protocol that if patient will sit with the other patient more than 10 minutes and the distance is less than 1.5 meter, he is at high risk. And if the time is less than 10 minutes and the distance between the patient and the other visitor, they are more than 1.5 meter, he is at low risk of getting the infection. So I think this rule
Yeah.
maybe apply for
Uh,
also this.
yeah, I
Another
give.
issue,
Yes,
Dr.
go ahead.
Qasim, sorry. Maybe one of the family member have low immunity or he have
Yes,
chronic
exactly.
disease or
Yes,
anything like that. You will not be sure, or he has wound or he has
yes.
surgery recently. You will not make
Yeah, yeah.
Because
This
the
is
mechanism of spread is
yeah.
it spreads from person to person and from skin to skin.
Yes,
So it's better they should wear all these precautionary measures. It's better. It's better. Gloves, mask, and then apron because it can spread from if you have wound on your hand, and it can you can spread this infection to the other patient with the direct skin contact.
yes. That's why also they put the patient under isolation. If is it
Yes,
MSSA, for example, maybe they will not put the isolation and they will not restrict the visitors and the nurses' care.
yes, yes,
And for the examiner and exam purpose, to be safe, better than leave it without safety netting, and it might harm the marks against the welfare, I mean. But if you say that it will not harm, no hazard to leave the patient in isolation for 5 days just to take care of this MRSA, and if he recovered, you can remove this isolation. But in the opposite side, if you didn't do the isolation and someone of his family get it, and as Dr. Ahmed said, maybe someone immunocompromised, cancer patient on chemotherapy or rheumatoid patient on immunosuppressants, and this infection or this organism reach to him, it might harm him. So for the safety, I think yeah, better to put him under isolation for 5 days. After that, repeat the test. If it's negative, they can remove the isolation and everyone will be safe and happy. Yes, this is my opinion again. But If anyone convinced with other opinion, either to share it with us just to know, or he can write it in that WhatsApp group or the chat box to get the maximum benefit. Okay, seems satisfied. Anyone has comment or question regarding these scenarios, both scenario or any other scenario, any communication scenario?
Dr. Basam, I shared something from that book because
Yes.
I don't have book. I have only the scenario one doctor shared me. So I'm sharing that in the group
Uh-huh. Okay.
so that
Can
everything should be clear.
Sorry, I should have been clearer at the moment.
Yes.
He doesn't have any infection and he is just carrying this bug on his nose. If the
Okay.
person is healthy, usually will not cause infection. We call this person MRSA carrier, but this bug can be infective when someone has a poor defense system. Fortunately, he has no evidence of MRSA infection. He is only a carrier. Okay.
So I have
Yes.
an experience. Yeah. My
Yeah.
husband is working as a neonatal consult. He's in neonatal unit. So what for me, I didn't face this. But what is they doing is, and usually in the with the adult patients, they are doing routine screening from MRSA. Okay, by the swab, by taking from the nasal and groin and axilla.
Okay.
If the patient is positive, it means he's colonized.
Okay.
In the ITU, and the patient immunocompromised, they're isolating him. And the doctor, if and also they are doing for the staff. If the staff also has MRSA colonization, he shouldn't come to the hospital for 14 days, and he will have the treatment at home. And as doctor asked her, 5 days and wait 2 days and do the test, and then they, as a staff, they repeat the test after 2 days for 3 times. So the test will be done on the 7th day, 9th day, the 11th day, even it's negative, to make sure that it's negative. And he told me also that the visitor can visit normally. Only the staff wear all the precaution, but the visitor can only they wash their hand. This is my
Okay.
told me now.
Okay. So no precaution. Another
Yes,
opinion with no precaution
me
to the
like
relatives. Yeah.
yes, in the unit, and even
Also,
for
Dr. Bassam, you said to him that this is for protect your father, because the isolation here this is for purpose of the others,
Yes.
and he is fine and no any problem with him. We just isolate him to protect the others and to protect the community from spreading this
Yes.
bug, but no harm for your father at all for this from this bug.
yes, and I think Dr. Bassem, you said that this infection it's normally present on the normal skin and that doesn't cause harm. You need to explain for the patient clearly that this infection, the MRSA, is present on the skin and it's not causing harm for any person. But the problem
But
spread
not the methicillin resistance one.
even the necessarily resistance.
It is
But
present, Dr. Bassam, but it's in hospital only.
Yes,
yes,
in the
Like
hospital worker,
but
hospital
it
spread, yes,
healthcare
doesn't
but
worker.
it
cause
is
Yes,
harm
not
normally maybe on any one of us.
of skin.
yes,
If you
but
you
other
will not,
other
if
community.
I
No,
am
I don't think.
sometimes I didn't I have no work in ICU at this time. I didn't do any swabs. If I will work for any defect in ICU, they will do for me swab. Maybe he will find me MRSA.
I
But I am
agree. I
working in
agree.
the ward
But
and
again,
ER,
still
and
health.
they have no problem with me if I'm MRSA
Yes.
with this. You know that
Yeah.
this is normally in any healthcare worker he can be carrier and normal skin commensal
Yes,
for him.
so you will tell him that it's normally on the skin. The problem when it breaks the skin and went to the blood, because this type of infection is very resistant to the antibiotic.
Mhm.
So it's the problem only when it will break the skin.
Yes.
So you will explain for him clearly this infection is on the skin. It's not harmful. Many patients might have it, but the issue we try to decrease the risk of spreading of this infection in the hospital, because the problem with this infection, it is resistant to many medication and many antibug. So that's
Mhm.
why we isolated to prevent the spread, because if it spread to someone has broken skin or someone immunity is low, so it might spread in the blood and cause for him severe infection, and it's difficult to treat. This is the main
Mhm.
cause of isolation. I think this
Yes.
is the important things to explain in the MRC. And we will
Yes.
give you, the treatment mainly topical in form of cream, in form of shower for 5 days, and then we'll wait 2 days and repeat it for you. And we don't need also to take all these details about the treatment. But
Okay.
I think you should say only it's not harmful if it's present on the skin of any person.
Okay. Only the harm if it invade the body. Okay.
Yes, because it's resistant. The problem, it is resistant to the antibiotic. This is the problem with the MRSA. That's why we take all this precaution and isolate the patient and isolate the staff who are in contact with immune patient also.
Okay. Thank you, Dr. Sarah and Dr. Aisha. Dr. Tanvir asked, can anybody explain about AVN, vascular necrosis of femur scenario? Yeah. So this scenario comes as a medical error, clear. Patient was on his irritable inflammatory bowel disease and he received steroid because he's embarrassing to take enema. And when he started the steroid, no one explained to him this complication. This is the error in this scenario because no one told him about the complication, which is a vascular necrosis. But a vascular necrosis itself is not it's not an error unless the patient doesn't know about it. Okay, let's have another scenario. Patient already explained about vascular necrosis and he received the steroid and he developed the vascular necrosis. However, he was informed earlier about this complication. This is not an error at all. It's one of the complication and side effect. It might happen, and he should be kept on calcium and vitamin D to make his bone more strong because this is one of the complication. If it happened while he knows this complication, it will be a complication, and you have to explain to him what the next plan. But if error, of course, you have to follow the steps of error. Okay, clear now, Dr. Tanvir?
Hello, Dr. Basim, how are you?
I'm fine. How are you, Dr. Tanvir?
I'm fine. Yes, I understand. This is actually sometimes can happen due to the best interest of the patient. We are giving medication as a
Yeah,
side effect can happen. That is actually not error. That is as a side effect. And
yes,
sometimes it's coming as error. Actually, my
yes,
question
exactly.
is how we'll explain about the avascular necrosis when it's happened, how we'll explain pathology and complication
Yeah,
and what are our treatment protocol, multidisciplinary. That is I'm actually asking. My question is there.
yeah. Okay, so simply the bone, some areas in our body, if all areas in the body supplied with the blood through the blood channel with use of steroids, some of this bone, the blood supply will be uh, poor little bit, some areas in the body, and this complication usually happen with steroid that the bone being more weaker and it might lead to due to also the poor blood supply to this area, it might lead to what's called a vascular necrosis of the hip. In this complication, patient should be observed, should be admitted, should be immobilized, take rest, and in some patients might lead to surgery and replacement of this joint. It's like this. This is what I can do. If someone has another explanation, he can share, no problem.
Yes,
Is it?
thank you, Dr. Basim. Yes, till now what you said, till now I know. But
Yeah.
is there any other extra point to add? Because as conservative treatment and even it's maybe need
This is
replacement of the
by
joint because
the group of
ultimately,
doctor. Yeah.
yes, multidisciplinary team, it's maybe
Yes.
replacement of the joint need the ultimate treatment. And so we will ask about also social issues and other occupational
Yeah.
issues, like other things we will involve. So is there need any other extra thing or till now? Because till now I understand, but I
Yeah.
am confusing. Is there any other point need to add?
No. Occupational therapist, of course, because he needs some walking aid. And if you
Mm.
can reach to the home, we will arrange a safe house because also he has possibility to fall because we want to be this patient safe of falls because if he fell down, he might have easily fracture. That's why we can call in our team the bone doctor along with the surgery, of course, physiotherapist, rehabilitation, because this patient need after the fracture or after the replacement to be rehabilitated again, and safely we can send him home after arranging his home along with the occupational therapist. This is the way how to explain it in the all directions. But what you said is enough. Yes, some patients might be conservative, others might need to be surgery or a candidate for surgery to be replacing this joint in the future. Because most of the sickler and most of the patient having this complication, they end up with replacement. It's a necrosis. It's not just uh, like osteoporosis. No, it's necrosis means already dead. You got it?
Yes, yes, yes. Ultimately, the treatment is a joint replacement, but before we can give some
Yeah.
supportive therapy. So, any medicational therapy like that here, like as you said, calcium, vitamin D, is it effective here?
Vitamin
And
D and
supportive.
calcium for like any patient with this weak bone or osteoporosis or any bone
But in the
problem.
necrosis case, it will be support here.
Necrosis, by the way, it's very painful. So supportive plus also immobilization, take rest, and sometimes they need painkillers, strong painkillers, because it's very painful.
There
Yes,
is other
exactly.
point here about the mistake. You will, if it is
No, no,
clearly,
apart from mistake. No, no, he's
yes.
talking about it as a complication, not a mistake. He want to know if happened as a complication, already happened after steroid without mistake.
So not no
Yes.
even uncertainty in this scenario.
No,
Yes,
no.
that is actually another issue. I'm not asking that issue. That is for
Yeah, yeah.
uncertainty or published. I'm asking about that disease. Like, if
Counseling.
any
He want
disease
to know
we are
how to
doing
counsel about
How
it.
counseling,
to explain يعني
yes,
this
Yeah, how
problem?
to
how to
Yes.
counsel
explain.
about it. Yes.
Yes,
Mm.
exactly. Because any disease we need to explain its
Yes,
pathophysiology,
of course.
mechanism, and how its complication develop, what are the symptoms, if not treated, what can happen, and how we'll treat it. Any disease we
Yes.
should be
Yes, of
counseled like
course.
this way. Yes.
Yes, you're
And
right.
another scenario came recently that there is a long time headache, on off headache, intermittent headache. The suspect as a medication overuse headache. So
Yes.
anybody know about that pathology of the medication overuse? Because so far I know it can cause us rebound headache. But if
Yes,
patient
exactly.
asks, doctor, you are giving medicine to reduce the pain. So why this medication causes headache? So if this type of the concern arise, how will
Yeah,
answer?
from the word itself, overuse of this medicine for simple or very simple headache. I know it's the headache for you, but the frequency and repetition of this medication and dependence on this medication with the time, you will be dependent on this medicine, and it will lead to what's called medication overuse headache. How to treat? We have to involve group of doctor and specialist. However, we before that we have to be sure that everything is fine, the social issue, the stressful condition, your sleep hygiene, everything is fine. Then if the patient is taking paracetamol, abruptly he can stop it, and we will follow up also with you if you have a change in the nature of your headache, because it might be masked by this antibiotic, or sorry, by the analgesic. Abruptly stop paracetamol, and for the opioid or other medication should be tapered down gradually in order not to have withdrawal symptoms and signs. Okay, but please be sure that you will give him some safety netting about any new headache, any change of the nature of the headache, because you might let him stop all this medicine and the patient will have severe headache. It will be, for example, something alarming. And because of that, he will not take the medicine, and he will not seek medical advice, and it might be something harmful. Before ending the meeting or before the closure, you can give him some safety meeting. If you have change of the headache nature or severity, seek medical advice or call your GP or visit us in the emergency. Okay?
We can just add the cause of this headache not known till now, and but there is some theories that it is like migraine, that it is like sensitization, that this is your brain and this is the site of the medication
Don't, yeah,
work on it, And this site will be with overuse of this medication will not present, so it will not affect the normal mechanism that your brain working to reduce your pain or headache.
No, I think medication overuse headache, how we'll explain it, we'll say that you know that you have, for migraine, you have triggers, okay? Because you are taking this medication too much, now the painkiller started to become the triggers for your migraine. So you need to avoid it and make your
Maybe,
body
yes.
use it. So the medication overuse headaches, it means that the painkiller now are triggers for the headache. This is what medication overuse headache. Because he's taking too much medication, now the painkiller not relieving him, it's trigger of migraine. So we'll explain it clearly like this, and you will have period not taking. There is alternative method, things that you will do. He will say, "I will have pain in my head. What I will do? Okay, we can give you topical painkiller, some exercising, good sleep hygiene, drinking too much water." At the beginning, it will be you have this headache, but it will decrease on its own till your body get used on his normal response to the painkiller. And then you will start to take it, but try again not to take it more frequent, because you might have this headache again and you'll get this medication overuse headache.
Exactly.
So the explanation of medication overuse headache.
Yeah, along with the alcohol, of course, smoking, explore
Yes.
all his social sub. Yeah. Sorry?
And one point I want to add, the patient will
Yes.
clearly give the history of more than 6 months in medication overuse.
No,
More than
not
6
6
months.
months.
Yes,
No,
more than 6 months. That I'm using these
two,
painkiller for more than 6 months. Whenever I'm using, I'm having more pain, more pain.
Dr. Azza, I remember 2 months for opioid in daily basis, I guess. 2 months. It's 3 months, Dr. Tanvio. So now we have 3 months. I said 1 month or 2 months. So 3 months, Dr. Azhar said, okay, two doctors
More
agree
than
for 3
15
months.
days per
More than
month,
15 days.
like then 3
More
months.
than 15
Yes,
days
more
for
than
every
15
day.
days every month
Yes.
for 3 months, not 6 months, Dr.
Yes.
Azhar. Very long
Yes.
time for 6 months.
No,
Yeah,
no, I'm talking about the duration of the medication overuse, because this criteria we are using for this tension headache like this, that our medication overuse you can say, but it is mostly the patients they are presenting with more than 6 months. Maybe I'm confusing.
no, no,
Maybe
no,
maybe
three
I'm
months.
wrong.
No, 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 it's 3 months, Dr. Azhar. Yeah, I
Yes,
got
yes,
And
it,
yes.
but
more than 15 days
3 months.
enough. Don't take the medication every day for 15 days. And also
yes,
you
but
can make a day.
for how many months? This is the definition. For opioid, if the patient taking it more than 10 days per month for 3 months. For the
For
paracetamol,
3 months.
more than 15, yeah, 15 days per month for 3 consecutive months.
Yes, yes. This is a definition. You
Yeah,
are right. You are right. This is
yeah.
definition.
So whenever he talks this medication in this long duration, and he has headache after that, it will be related to medication overuse headache. And I didn't correlate to migraine, Dr. Sarah. It might be other cause, not only migraine. So it will not be trigger. You cannot say it's trigger for migraine. What if he's having tension headache?
Tension.
So
Yes, yes.
yeah. So
But
according to the scenario, don't stick to the
yes, yes,
migraine.
yes. I'm saying about the scenario which she
Of
said
course,
clearly, medication overuse headache for migraine.
for migraine
Yeah.
exactly. Okay, but
Yes.
for others, yeah,
No. And
it
also
might be different.
a diary. You can have a diary to write every time he's taking the painkiller, and to see how
Okay,
many times he's taking it in order to prevent from having this medication overuse headache again.
yeah. So plenty of water, relaxing technique, stress-free, alcohol and smoking-free. All these things, external factors, might be the triggers plus the medication itself. So in order to be successful trial of stopping it, please be sure that you are taking care of your social and all other life uh, issues. Okay, this is the best way how to explain and how to address it and how to treat it. I think it's clear now for all, Dr.
Yes,
Tanvir
yes.
particularly. Yes, good. Yes, good to know. Thank you. 10 days for opioid and triptan, 15 for simple analgesic for 3 months or for 3 consecutive months. Okay. Thank you, Dr. Tanvir, for raising these issues for refreshment and revising. Any comment, any question? Okay. If all satisfied, once we will stop this. Once you stop this, you might have headache. We will advise you for relaxation technique, ice pack, and acupuncture. Sometime you can take some painkiller with help of GP, non-steroidal anti-inflammatory. Don't mention medication. I prefer you can tell him yes with GP follow-up. He will prescribe for you the best interest. Is it non-steroidal or any type of? Because again, you put him
No, you
under
couldn't have any medication, even non.
yes,
He
yeah.
will only can took topical Voltaren, topical like this.
Yes, exactly.
Size.
Because once,
Yes, no tablet at all.
yeah, once you open this door again, he might take the non-steroidal on dependence way, and he will develop kidney injury or acute tuber necrosis or kidney failure. So don't offer another medication. He will abuse it again. Try to let him totally free of this painkiller. Totally. Okay? This is the best way. Anyway, thank you, Dr. Muhammad. Muhammad. Okay. Any question else before ending the session? Any question, any doubts?
No, Alhamdulillah, everything clear.
Yeah, thank you. Thank you, everyone. Thank you, Dr. Azhar, with practice today for the practice with me and the scenarios. A very nice scenario, really. Long time we didn't practice such scenario. And hopefully, inshallah, have a nice weekend. Enjoy your weekend. See
Inshallah.
you, inshallah. See you next week. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.